Good afternoon to all. I hope everyone have a good lunch. Okay, so we hope we all are happy and we all are healthy. So here just, I'm Dr. Jemimah, already she introduced myself, but anyway, small introduction about me. Audio. Okay, so anyways, so the video played over here, first it says food is medicine and medicine is food. So it is together with my picture, so even if you forget me, no worries, please don't forget this one, food is medicine is food always. So just quickly we will go through our let me understand something like how many of you know like the traditional medicine that is called Siddha medicine? Nobody, right? Yeah, no. Ayurvedic? So many of them you know. Good, thank you. So now we are going to quickly understand the ancient Indian traditional healing practices through proven medical solutions. So my agenda will be like this, like a quick introduction regarding all the traditional Indian medicines, which consist of Ayurveda, Unani, naturopathy, and homeopathy. And we will just discuss on some of the origin, how it originated and the basic concept of it. And basically today I will be discussing only on Siddha medicine because most of my colleagues over here, they have already discussed Ayurvedic medicines. And also the prominent scopes of Siddha medicine and the principles of our medicine and the uniqueness in Siddha medicine and various medicinal herbs and the importance in the treatment options and very importantly, the proven healing practices which with many case studies. So that is clinically, trials are being done, and we have more clinical studies over there, which will be presented in this session also. And also how we can see the traditional practices, which now had been already integrated with modern healthcare techniques. We can discuss something on that. And finally, if you want to opt for this kind of treatment or any medicines, you're always free to reach. So I have given you the list of university medical colleges and hospitals in India for your reference. So let's quickly go into it. So you already know that India is a diverse land which have a lot of traditional medicines originated from India. So these are the medicines you can see, Siddha, Ayurveda, naturopathy and yoga, and Unani and homeopathy. So I don't want to discuss in detail on that. So my topic will be Siddha medicine. So we have a ministry from India which is called Ayush, which standardizes and which regularizes the medicines which is prepared. And the clinical trials are done by this Ayush Ministry of Health, okay? So this is the one. And if you quickly see, the origin of Siddha is basically very long back, as my colleagues over here during the last panel discussion. It originated basically more than 2,000 years ago, about many years ago when there were no scientific interventions were there. Our ancestors, basically we call them as siddhas or saints, whatever. They lived for long years. They invented this medicine through their practices and proven solutions. So as per Siddha medicine, we have 4,448 types of disease, and we have medicinal treatment with this external and internal also. So I will quickly go through it. So the basic concept of Siddha is the 5 components. So you already know, like whole universe is also made of 5 components. That is earth, water, fire, air, and sky. So same, our body is also made of 5 components. So both correlate with each other. If something goes wrong in the 5 component, automatically our body will also be affected. So that is the main thing. An interesting aspect, what I have to mention over here, we all know vaccines, right? How many? We all know, and we have took vaccines also. So during those years when vaccinations or vaccines were not intervented, you know, our Siddha practitioners, they did a clinical practice like smallpox and chickenpox, you know that. The treatment of smallpox and chickenpox basically with turmeric and neem. They don't have any vaccines. And how they do vaccination during those days, actually they took the crust of this lesions and they do allow the other people to inhale those crests, so which automatically create the immunity for them. So vaccines were created, not now, long back ago, by our ancient practitioners. And also the basic concept of Siddha. So as we said, food is medicine and medicine is food. So whatever you have, whatever you eat, if you have to have it to the limit. If you eat something more than it will become a poison. And we have three main factors, which we call it as the basic factors for Siddha medicine is Vata, Pitta, and Kapha. These is the main components which is there in our body, and we do diagnosis based on this analysis. If some component of it's deviating or this variations is there, then automatically it leads to disease. So when we want to correct a disease or when we want to cure something, you have to clear this components instabilities or imbalance. So it should be running in our body with a balanced state. And we basically depend on the food. I already mentioned you, and because the food, it has 6 types of taste. So every disease is related to your taste. So for example, if you have a common cold or flu or something like that, so it is a disease of Kapha. So this disease, you should not be having anything sweet. You have to have something opposite of it, that is a sour taste. So when you have a food of sour taste, automatically your Kapha level will be stabilized and you will be getting healed from your flu or cold or whatever may be. So that's the reason we always say medicine is food, food is medicine. And also a basic concept, the 6 taste is made of combination of each components out of this 5 Panchaputas. That is already there. So the basic concept of Siddha is like basically predictive, that we diagnose, preventive, personalized, and also participatory. So in Siddha medicine, basically, rather than going for a surgeries, we recommend for conservative treatments. So my slides will be there as a clinical practice. So the prominent scopes of our medicine is a herbal treatment. So herbal treatment is a plant-based medicine. So food is our medicine, so all the medicines the food is our medicine, it is a plant-based. And we have a regeneration therapy, we call it Kaya Kalpa. So in ancient days, our physicians, our siddhas, they lived for more than 100 years, 200 years easily. How it is possible? It is due to this Kaya Kalpam. Kaya Kalpam is nothing but a combination of combinations of plants or the fruits like amla, honey, ginger. So these they started eating it regularly, which became their habit, and they were able to live for long life. And we always concentrate on mental health because Siddha says body, mind, and spirit should be unified. And we have a preventive medicine also. And as we already discussed on this, there are 3 main vital factors. We already discussed on this, Vata, Pitta, and Kapha, and 5 elements we know. And we have 7 basic tissues, that is our body components. So I'm quickly skipping on this because I want to cover all the slides. So whenever there is some changes in any one of these components, it automatically leads to disease. So it has given you. And as I already discussed, when there was no diagnostic methods invented, either blood test was also not there to diagnose the disease, our traditional practitioners, they do diagnosis with these methods. That is tongue examination, color examination, speech, eye examination, stool examination, urine, touch and palpation, and the pulse examination, that is Siddha pulse examination. So out of which, so if you see this is a unique pulse examination, you can see here. So the Siddha practitioners, they diagnose a disease by carefully analyzing this patient's pulse with the rhythm, strength of the pulse, and also location. So it should be 1, half, and quarter. If any one of is differentiating or imbalancing, automatically the body have a disease. So based on the imbalancement, so if the Vata is more, we will give medicines to control the Vata. Similarly for the other pulses also. And also this is the same, we have given the symptoms when like these components or imbalancing, you will get these disease. So you can have this as a reference, I'm quickly. And this is a unique examination. You will say what is unique in it. So this is a normal urine examination, and we have one more examination in the urine, which is called, you can see here, basically they drop a gingerly oil on the collected urine. So based on the settlement of the urine drop, they diagnose whether the condition is acute or chronic. So there are that much knowledge there. So these are the routine things. So this is related to this oil examination in the urine. So the uniqueness of Siddha, so we already discussed, this is Kaya Kalpam, pulse diagnosis, and yoga and medications, and very importantly, the Varma therapy. So I'll be talking on that. So these are the treatments. And what about the medications in Siddha? So the medications in Siddha actually of 3 types. This is the plant origin. So we all know it is a herbal-based, plant-based medicines. It is harmless. The second one, we use animal-based, like the ghees, milk, curd, yogurt, whatever we call, we use it. And the third and very important thing is the metal and mineral origin. We call it as herbo-mineral products or mineral products. So you might be thinking how this mineral, we are not using the mineral products like Azara or directly. We are making it into a nanoparticle. We are processing it. And finally, the toxicity of the products are clearly verified, tested, analyzed, and it is recognized, standardized by Ayush, by IMCAPs and various drug mandatory companies, and then only it is released for use. So no need to worry on the toxicity of drugs. Okay, and the strengths, as I discussed, and this Kaya Kalpam already we discussed, and the drug standardization. These are the organizations who standardize the drug. It's not like before. Before we used to say that Siddha medicine we have minerals which have toxicity to liver, kidney. No, because we have many drug organizations, standardization organizations who do standardize these drugs for toxicity. Okay. So these are some good food habits and lifestyles which is followed by our ancient traditionals, and they advise, and we advise you to do the same. Please always drink warm water instead of cold water. Okay, this is my first advice. And take food twice a day, and take quality of cow's milk, and do therapeutic emesis. Emesis, you know, it's like a cleaning of our stomach. It's a vomiting thing, like. So it could be done by every 6 months, and we have therapeutic purgations once in 4 months, and we should install nasal drops. Nasal drops, it's not as a medication, it's as a preventive medicine. We can use it for every 45 days and take oil bath once in every 4 days. And we usually use eyeliners as makeup, as cosmetics. But our traditional practitioners, they use these eyeliners as a treatment. We have medicated treatments. And we have unique external medications and treatment options. You can see here, these are different external treatments which are unique for our Siddha medicine. So you can see here everything just, so this is called Tokanam, or this is a form of massage therapy with medicated oil. And it treats hemiplegia, paraplegia, and all muscular disorders, and also sciatica, on most of the musculoskeletal disorders handled by these therapies. And we have Rotterdam. This is like a fermentation thing where the medications are put in a pouch and they are used as a treatment. And there are many different diseases treated over there. This is medicated pouch. And this is a very important treatment method, which we call it as antiviral or leech therapy. You would have heard on it. Actually, leech therapy, these leech are grown in a medicated situations, and these leech are used to treat and remove the toxins of blood. So basically, we use this leech therapy for arthritis, eczema, and dysmenorrhea, many disease, okay? And this is a type of cauterization which you use small heat therapy for treat various arthritis and sinusitis pains. So let me quickly go through this Varma therapy. I don't know. How many of you heard this Varma therapy? So it's a unique thing. It's all over body we have 108 Varma points or energy points. So this Varma therapy is nothing but stabilizing or releasing the energy from these points through like hands, with some pressures and massages. So this have given a unique effect, and it have greater beneficial effects in controlling the fatigue and nausea of chemotherapy patients. So the chemotherapy patient usually have like side effects of nausea and fatigue. It is controlled by this Varma therapy and yoga therapy also. Other than that, the Varma therapy have many benefits. You can see here, cervical spondylosis, migraine, psychiatric disorder, asthma, many things, okay? So these are the Varma therapy points. So recently, in December 18, 2024, in the Natural Research Institute of Chennai, India, there was a Guinness record made to create an awareness of this Varma therapy. So nearly 555 community people received Varma therapy from 555 practitioners. So this is the newsletter of it. You can quickly go through it. And this is a small video related to that. So it has some Varma, just why I am playing it, just for you information, how the Varma is done. So through this, many diseases are healed. So it's a unique technique of Siddha medicine. So I will quickly skip over it because I don't have time for it. And this is one of the greatest achievement I can say. Because you can see here, Mora School of Medicine students to travel to India for training in Siddha medicine. So in US, the Atlanta University have recognized our Siddha medicine, the traditional healing practices, and the medical students over here are sent to India to have training from our doctors. So this is the, you can see here, this is from the newsletter. And this is a very important thing. This is the yoga or asanas. So I was discussing with some of our colleagues that yoga or asanas is nothing but a positional change of our body. So you can see it can treat many chronic diseases, not only our psychiatric disorders, it's creative digestive disorders, it's like it can treat any, even the thyroid disorders and any reproductive disorders, disease or cured by this asanas. So you can see here, every posture heals specific disease. So when we practice these asanas or posture, we will be able to get rid of these disease. Okay, I'll quickly go through it because I don't have time. And this very important slide, actually. Let's go back. So this yoga therapy, it's an integrative. So my colleague was mentioning also MD Anderson Cancer Center. Actually, it has recognized yoga therapy as an integrative medicine for cancer patients. So it's already there. And this is a very important thing. This is the Vasi or Pranayama, is our breathing exercise. If I could find a time, or if time allows, we will do a breathing exercise with it, actually. It is very useful, actually. It clears your mind, and it controls your blood pressure. It controls your asthma. It creates like happiness from your inner. And also it creates all the heart disease, and most of the disease are cured by this pranayama. So this one I quickly see, this many diseases are treated by this Vasiya pranayama. So if time allows, we can have a quick rehearsal of it. And you know already, there are many medicinal herbs and plants which are originated from India, and it's treating many diseases. And my colleague were discussing about turmeric, curcumin. And also we have amla, we have kilanali, thuduvela. Every one plant have their own potential of anti-inflammatory, antiseptic, antioxidant, anti-cancerous. So I don't have time to discuss very in detail, but these are the plants and their uses. So I'm quickly skipping over it. So this is a very important topic. So these are proven healing practices and medical solutions with case studies. So before going on, actually, our Siddha medicine treats chronic diseases, mainly skin diseases, which could not be treated by other medicine department, or it is a chronic thing. So for everything, I'm speaking with a proof, and there is a journal for it. You can go and look into it. So here, a clinical study done on psoriasis. So you can see the psoriasis, how it was, and after This is after 17 days. You can see the difference over there. And after 17 days, so this is, you can see the desquamations, how it get healed after 45 days. So this is before and this is after. And this is also the psoriasis patient. As a different patient, this is. So I'm quickly skipping on it because the picture is shocking to you. This is after 45 days, so you can see. This is a case study and a clinical trial done with this medicine, and it has been proven. So the graphical, and this is very important thing. We all know diabetic foot ulcer, and also cutaneous ulcers. So with a single decoction or like a single medicine called Manjiti, these non-healing ulcers are healed. So you can see there, and I have given you the references also. You can just go through it, and it's a proof in front of you. With a duration of 2 months, in 50 days, the patient was taking only internal medicine or internal decoction. That's it, herbal medicine, not any external, but it's healed after 50 days. And you can see the traumatic ulcer, how it healed after 70 days. And also you can see these all bed sore, how it's healed. You can see there after 45 days. And this is a very important thing. It's a diabetic trophic ulcer. So you can see within 40 days how the healing is. You can have a closer look on it. So I'm quickly saving out it. This is varicose vein ulcers, which is healed. And this is one of the typical case. This is a dermatitis treated with Siddha medicine. And you can see the difference after 90 days. This is only internal medicine. And this eczema, we don't have any internal medicine. It's only an external oil. You can see the difference over there. And is also lichen planus. This is also an external oil only for 1 month, and you can see the difference over there. And each and everything, I have kept a reference for you. And we all know COVID-19, right? So we have lost our loved ones, and we never forget COVID-19 in our life. So during COVID-19, India also have a lot of mortality rates, but we have a medicine invented, or we were using there, which is called Kabasurakudini. This is made of 15 herbs. These are journals. If you see, the death rate in India, basically in South India, is far less than the other part of India because of the usage of this Kabasurakudini, of this decoction or a herbal tree, whatever may be. So this is, I can? Okay, so these are the graphical representation. I quickly skip over it because I'm getting signals from back, sorry. So it has proven results. COVID-19 is cured by this medicine. So this is a typical treatment for, actually Siddha medicine have treatment for hemorrhoids, for fistula. So this is without any surgeries. So here is a unique procedure we call Karanul Sigichai for fistula. So this is nothing but a medicated thread is tied over the fistula opening, and it's allowed to heal by itself. So after tying the medicated tool, the patient will be receiving some stitch bath and some outside wash and something like that. 5 minutes, sure, quick it up. So these are integrants. You can say it's a plant-based, and then nothing over that. So just I'll quickly go through the case studies, the clinical trials. So this is how they are sterilizing the thread, medicated thread. And it is stored, and they are tying the medicated thread, and they do a preoperative. This is the way you can see there for the fistula. The medicated thread is being tied, and it is left for 1 week, and after that it's changed. So you can, while I'm showing this, you can see the difference over there. This is baseline, and that is before treatment. This is after treatment. So various case studies over there. So I'm quickly skipping up since I don't have time. And this is a very important case. This is adenomyomas. The patient was advised for surgery. But with a treatment of 3 to 4 months, you can see the report, the adenomyomas is not there. And we have jaundice treatment, very unique jaundice treatment in herbal medicine. So with the bilirubin level 14.7 came down to 2.9 with 15 days of treatment of this plant-based herbal treatment. And coronary artery disease, you can see that. This is only plant-based medications over here. So this heals nearly like 99% of blockage of a CAD of patients. And tonsillitis, you can see there, the difference over there. The patient was scheduled for surgery. It's a conservative treatment. And blood sugar, you can see here within 20 days, the blood sugar from 196 came down to 126. So diabetes, many of them, they're talking on the diabetes. The first thing to prevent diabetes is please stop your sugar-coated or sugar drinks, please. That is a very important thing. And we have herbal medicines for it, and how we can collaborate traditional practices with the modern healthcare systems. So let me quickly go through it. WHO organization have already accepted and agreed with traditional medicines and its effectiveness in chronic disease treatment. This is already repeated. So this is very important thing actually. How many of you heard about this DMD? I don't know. The child, when is affected by this DMD, could not be able to walk, and it becomes wheelchair bound. At the age of 30, automatically their lifespan ends. But with integrated traditional medicine and our modern medicine, we are able to make this child walk. Okay, that's the first thing, and their lifespan is increased. So there is a video actually. I don't know whether it's able to play there. This hospital, actually, it treats CP patients, spinal cord injuries, DMT, muscular dystrophy patients, so everything. So the treatment actually is a traditional treatment. First, they do some, you can see their child is allowed to stand with some support, and they do some bandaging. We call it as Kattu therapy actually, and many exercises together with that physiotherapy is done, together with that hydra therapy. That is, the baby or the child is allowed to stand like this with therapy, and then they will be given physiotherapy, that is hydra therapy in the swimming pool to delay the cardiomyopathy, and also they get the help from neurosurgeons, orthosurgeons to treat the patient as per their requirement. So still now, this clinic or this hospital is working, and it started 38 years ago. So it's a long tradition over there. So this is a treatment over there, and hospitals. And as my colleagues mentioned, for cancer also, we always have traditional medicines. The curcumin and these all things, we have integrated medicines. And for cancer treatment, we have direct treatment also with herbo-mineral medications, or also herbals also. So this is a live case from the newsletter that this is one of the famous cricketer who treated or who gave his wife with normal diet with turmeric, neem water, apple cider vinegar, lemon water, and with strict diet, she is able to fight stage 4 cancer. And these are regulatory bodies, and these are hospitals and colleges for your reference. And basically, finally, these are some pictures where we do community services for our people with our treatment. And these are references. And I have to always thank Hannah, my colleagues, my friends, my doctors, who always there serving our people. So hats off to our doctors. And this is Siddha medicine. It is a holistic healing practice which basically concentrates on plant-based medicines rather than like surgery or weed. Yeah. So we treat all the chronic diseases. So I'm here. So anytime you can contact me. And for sure, we are always here to support our society, a healthy society. So thank you all for listening to me patiently. Stay healthy, stay balanced, and stay blessed. Thank you.